My name is Myra Wiley, and I'm the Program Director for Hands to Hearts Academy. Today, we will be demonstrating Peri-Care for the female for the State Registered Nurse Aid Program for the state of Kentucky. All skills have opening steps of knocking on the door, identifying yourself, greeting the resident, explaining the procedure, gathering your supplies, and providing privacy. Once you've done those things, the next thing is perform hand hygiene, and we want to raise our bed for good body mechanics. So I'll raise this bed rail and I'll be working on the other side. This bed is a crank bed, so you will not see me raising the bed up and down, but you will hear me verbalize. I'm going to put on my gloves. And we want to, after we get our gloves on, we'll fill our basin with warm water. We're going to pretend this is our sink. Over here, we'll fill our basin with warm water, and we will place a waterproof pad underneath the resident. Our other supplies will be rags to wash, rinse, and pat dry. For the state test, you can either use one rag and just identify it, or you can use 3 separate rags. Our patient we're working with today is Miss Dora. Miss Dora, my name's Myra. I'm gonna roll you over so we can put a waterproof pad under you. We're gonna fan fold our linens to the bottom of the bed. And then we're gonna take our bath blanket for privacy. We always start in the middle of the resident, and we always open our linens head to toe and then hip to hip. We're gonna take our basin of warm water and rags. We're gonna pull the bath blanket up to expose only her peri area. You have the option of either flexing her knees or just stretching her legs out, whichever is comfortable for you. You're gonna take your hand and you're going to separate the labia. You have the option of using 4 corners for your rag. So you start with the rag this way, you fold it over once, and then you fold it over again, and now you have 4 clean sides that you can use to clean the resident. The other option you have for the exam is a bath mitten, where you can take your pointer finger and your thumb, wrap your rag around your hand, and then tuck it underneath to make a bath mitten. And now you have 3 sides of the rag that you can use to clean your resident. I'm gonna use 4 corners to clean our resident. I'm gonna separate the labia, and we're gonna start from the top to bottom, and we're gonna wipe in a downward motion for infection purposes. So I'm gonna start on the right side, and I'm gonna start from the top and wash all the way down. I'll take a clean part of my rag, go in the middle, wash from top to bottom, all the way down. Get another clean side of the rag and wipe on the left side from top to bottom, all the way down. I will get my rinse rag and repeat the same steps. Washing on the right side from top to bottom, the middle from top to bottom, and the left from top to bottom. Lastly is my dry rag, and I'm gonna pat dry on the right, pat dry down the middle, and pat dry on the left. Now I'm gonna ask Miss Dora if she can help me roll on the side to finish her peri-care. Again, I'm going to continue to use 4 corners. And we're going to start from the vagina all the way up the anus, washing, using a clean side of the rag each time. I always encourage to make sure you wash both butt cheeks as well. Once you wash, then you have your second rag. You want to rinse, And now we're going to pat dry. Again, every time we're using the clean side of the rag, and we're making sure we're going from the vagina all the way up her butt cheeks. Now we can remove our waterproof pad, roll our resident back. We'll pretend our garbage is beside us. We'll dispose of that in the garbage. We'll remove our gloves. We can remove our privacy blanket. We will dispose of this into our dirty linen. We will put away our supplies, clean them and store them. Give our resident her linen back. Make sure that she has the call light. We're going to make sure we lower the bed for safety. We're going to go around on the opposite side of the bed, and we're going to lower this bed rail. We'll ask our resident if she needs anything. We'll perform hand hygiene, and we will record and report.